Hi, this is Kat and Tim Barnes.
Hello.
And for Voices for Primary Care, we said that primary care is teamwork.
Now, Kat and I got married recently, and so we've been experiencing teamwork in all kinds of ways. One of the things that's become kind of apparent is that collaboration and coordination are really important. And some ways we've experienced this so far is kind of taking care of each other's needs at different times in our relationship. When I was doing my doctoral defense, I was living at the office, basically, had no time for anything, and Kat was nice enough to kind of make food and just take care of my sanity during that time. And then later on, when she had a particularly difficult internship, I was able to turn it around and make food for her, and so we got through both of those okay, better than we would had we both been on our own.
And so when we think about primary care, we said primary care is teamwork because when we have the goal of taking care of patients, we're learning that no one person can do it on their own. You just can't know enough. You can't be in the office enough hours of the day to really take good care of people unless you've got a team. And that team needs to divide roles when appropriate, and sometimes it means different people will chip in to take over roles at certain times, just like we're finding. And really, I think it's about collaboration in the sense that we're dependent on each other and we need each other in order to get the job done. So just like in our marriage where we need each other, primary care teams are a similar kind of family where we all have to work together and understand how to use each other so we can meet our goals. Thanks.
Hi, I'm Dr. Mark Manso, and I'm a fourth-year psychiatry resident at NYU with a background in public health. Good primary care is good mental health care because primary care physicians identify and treat most mental illness and substance abuse problems in the United States.
My hometown primary care physician, Dr. Robinson, inspired my message that primary care lets us have doctors who grow to know us like family over the years. For more than 10 years, Dr. Robinson has been there for many of the hardships and triumphs of my family. Since day one of my mother's diagnosis 3 years ago with diabetes, he has been instrumental in ensuring that she has successfully transitioned to living with the disease. He has also seen me transition through high school to earning a master's degree. You'll still find that he still has posted in his office space a newspaper clipping about a citywide academic award I won during my senior year of high school. Dr. Robinson to me epitomizes what a primary care physician should be, someone who truly cares that his patients stay healthy and happy.
My name is Stephanie Ames, and I am a field organizer and trainer at PCP. My message in the Voices for Primary Care campaign was primary care saved my mother's life. This was because my mom was sick when I was a little kid, on and off for a really long time, and it wasn't until she met her current primary care doctor that things began to change. This primary care doctor took the time to listen to my mom, to take her medical history, and really understand my mom and our family's life. It's been 15 years and my mom is doing great. And she's doing great now all because of this primary care doctor.
Hi, I'm Molly Talley. I love my work for the Pennsylvania Academy of Family Physicians, but I also personally believe in the value of family medicine as a patient and a working mom with a busy family. The problems with our broken healthcare system can seem overwhelming, but I'm lucky to be in a position to see real solutions popping up all over the country led by innovative physician leaders in family medicine and other primary care specialties. I have faith that these innovations like direct primary care, the patient-centered medical home, and meaningful payment and healthcare reform will usher in a new era of value-based healthcare and wellness to turn the tide of our nation's health. But I want to speak now of my experiences with family medicine in my personal life and leave the advocacy for another day. Our family physician and his practice team provide my whole family with our preventive health needs and take great care of us through illness, injury, and more complex health crises, like my husband's back surgeries. This family practice cares for most of the residents in my small town. Indeed, our family physician cares for every local member of my family. That's 17 of us, kids, parents, grandparents, all residents of the same town and patients of this family practice. The truest test of the value of our family doc came with the long ordeal that was my mother-in-law's battle with lung cancer. The one constant through the healthcare haze was our family doctor and his quiet, caring manner. He was the first to convince her to get a chest x-ray and knew how important it was to her to have her son, my husband, with her every step of the way. He would call my home in the evenings to see how my husband was doing with the unspeakable stress and worry. He helped us sort out the recommendations of subspecialists and navigate the mysterious network of service providers. He cared for her in the hospital, advocated for her, and was our most trusted advisor. He was the first to call before that first Christmas with the good news that the chemo and radiation had successfully beaten back the tumor in her lung. He was also the one by our side in the hospital several Christmases later as she took her final breaths. My family doc helped show me what the physician-patient relationship means to the whole extended patient family in circumstances like mine. That trust is the real foundation of the physician-patient relationship. And with family medicine, it extends beyond the patient to the family, extended family, and community. Healthcare like this is not just a commodity. It's a blessing, a gift.
Hi, my name is Carolyn Gone. I'm the Executive Director of the Kansas Academy of Family Physicians. Kansas family physicians provide most of the primary care in Kansas. With more than 990 practicing family docs, we're the biggest medical specialty society in the state. I love family medicine and have been privileged to be the executive director of the Academy for 23 years now. This specialty is really the backbone of primary care in Kansas. We have strong departments on each campus at KU School of Medicine and 4 incredible family medicine residency programs. So when I think primary care, I naturally think family medicine.